Hi, I'm going to talk about female infertility. What is female infertility? I'll be defining it from four perspectives. The first is when a woman is unable to get pregnant after 12 months of regular unprotected sexual exposure for women who are less than 35 years of age without using contraception or birth control. Second scenario is when a woman is unable to get pregnant after 6 months of regular unprotected sexual exposure for women who are over 35 years old. Frequent miscarriages can also be considered infertility. Then the last scenario referred to as secondary infertility is when a woman has previously had a child but is no longer able to get pregnant. We now want to look at the causes of female infertility. Before we do that, we want to take a look at a normal female reproductive system, what it looks like. The picture we are seeing now is a picture of a female reproductive system. The first one you can identify there is the ovary. Then you have the fallopian tube. We have uterus, the cervix, the vaginal canal. Now we know what a normal female reproductive system looks like. We now want to look at what causes female infertility. We have uterine issues. Now, among uterine issues, you have polyps. Now, polyps are non-cancerous tumor on the surface of the uterus, and this can interfere with pregnancy and make it difficult for a woman to remain pregnant. As you can see in the picture, there is a polyps, and the second scenario, you also have another polyps. The second uterine issue we're going to look at is fibroid. These are non-cancerous growth within the wall of the uterus. Now, at times people get confused. What's the difference between fibroid and polyps? Well, polyps grow on the lining of the uterine wall, and whereas fibroids go within the wall of the uterus. So those are the two differences, and both are, of course, non-cancerous growth. Then we have also cervical issues. That is when the cervical canal is very narrow. It may be difficult for sperm to pass through. And then the other scenario is when the cervix is unable to produce adequate mucus that allows sperm to pass through the cervix into the uterus. Then another uterine issue could be defect from birth, such as abnormally structured uterus. Another cause of female infertility is fallopian tube issues. Now, this is damage to the fallopian tube or blockage to the fallopian tube. Now, there are a lot of things that could cause this damage or block to the fallopian tube. This can be caused by pelvic inflammatory disease, an infection of the fallopian tube. It could be caused by sexually transmitted infections such as chlamydia, gonorrhea, which damage the fallopian tube. Then you could also have endometriosis. Now, this is when tissues like the one on the uterus starts growing in other areas like the fallopian tube. When that happens, it blocks the fallopian tube. Then when it grows around the ovary, then this can cause heavy menstrual bleeding and bleeding between periods. Then fallopian tube blockage or damage can be caused by previous use of intrauterine device. Maybe it wasn't well inserted or whatever thing, or an infection arising from it, then that can cause damage or blockage of the fallopian tube. Then having previous pelvic surgery can cause damage or scar the fallopian tube. Ovulation disorder is another problem that can be responsible for female infertility. So you have a scenario where ovary stops working early in age. When this happens, it becomes early menopause. The second one is when the ovary produces poor egg quality. This is a situation where probably the number of chromosomes that should be in the ovary in the egg is less than the required number. When this happens, fertilization is difficult and makes conception very difficult. Then you have hormonal imbalance, which affect the release of eggs by the ovary. Then the other aspect of the cause of female infertility is what is referred to as unexplained infertility. Now, reports suggest that about 20% of women suffering from infertility actually have this situation. Now, what does it mean? The woman appears to be healthy, the reproductive system is healthy, everything is fine, the partner is fine, yet she's unable to get pregnant. So this is referred to as unexplained infertility. Okay, now we've looked at the causes of female infertility. Let's look at risk factors that could predispose a woman to becoming infertile. Now, one of them could be age. The older a woman gets, the quality and quantity of eggs she produces declines. In many cases, this starts from the mid-30s. The other is alcohol. According to some reports, alcohol intake lowers the chances of getting pregnant. Smoking could reduce the chance of getting pregnant. Weight is an issue too. When obesity can cause irregular ovulation or irregular periods, while the other extreme, being underweight, often caused by eating disorder, can result in shutdown of reproductive system. Then history of sexually transmitted infections, STI, can cause pelvic inflammatory disease and fallopian tube blockage. So now we've considered the risk factors. Let's see what you can do to reduce the risk factors. Now, some of the causes of female infertility can now be determined or be prevented. However, the risk can be lowered by reducing the risk factors and adopting a healthy lifestyle. So what do? Well, the first thing, keep a healthy weight. Avoid getting overweight or underweight to avoid ovulation disorder. Exercise moderately. What that means is you need to avoid regular, long, intense, and very strenuous exercise. This has been reported among some facing infertility challenge. So exercise moderately and avoid very strenuous and intense exercise. It reduces your chances of getting pregnant. Avoid alcohol. Yes, avoid alcohol if you are trying to conceive. Quit smoking. Smoking reduces your chance of getting pregnant and increases the chance of miscarriage. That includes passive smoking. Yes, passive smoking, finding yourself in the midst of heavy smokers or a smoking environment. That can also reduce your chance because at times you're actually taking more smoke than the smokers themselves. Reduce stress level. Stress or depression can affect your hormones, resulting in ovulation disorder. Reduce the risk of sexually transmitted infection. Practice safe sex when you are not ready to get pregnant, and avoid multiple partners to reduce the risk of sexually transmitted infections. So you also need to limit your caffeine intake. Now let's look at some common causes of caffeine, because when we say caffeine intake, you want to know, so what is caffeine? How do I get it? The common causes are: 1, green tea, coffee, soda drinks, energy drinks, and dark chocolate. So when you are trying to get pregnant, then you need to reduce or limit your intake of these things. Now, how can I treat infertility? How can you treat it? Well, there are different tests available to determine the cause of infertility. Your gynecologist can advise you appropriately on that. However, when the cause is determined, we have effective alternative prescriptions that deal with many of the causative factors. Now, the treatment focuses on: 1, increasing the chance of conception by treating causative factors such as polyps and fibroids, pelvic inflammatory disease, infections, and other things associated with the causative factors of not being able to conceive. Then we also deal with reducing the risk of miscarriage, and then address issues of hormone imbalance. Okay, so how do you consult for treatment? Well, you can contact us, WTL Health 48 at gmail.com. or WhatsApp +234 706 763 9302. And if you're in Nigeria, 0706 763 9302. Check the website below for products that can help with general health and well-being. wavenet.com.ng/brand/for-how. Read more health articles from our blog post at treatyhealth.blogspot.com. Remember to like our video, subscribe to our channel, and share. Bye bye.